My name is Carolina Sandler. I'm an accredited exercise physiologist and lecturer in the School of Exercise and Nutrition Sciences. And today we'll be talking about interdisciplinary professional education. So I thought the first thing that was important to do is to discuss really what is an accredited exercise physiologist. So this is the definition that comes from the Exercise and Sports Science website. And so ESSA, or Exercise and Sports Science, is our accrediting body, our governing body. So exercise physiologists aren't covered under APRA, they're covered under Exercise and Sports Science Australia. So this says that basically AEPs are university qualified allied health professionals equipped with knowledge, skills and competencies to design, deliver and evaluate safe and effective exercise interventions for people with a range of medical conditions, injuries and disabilities. And so one way that we think about this is that we use exercise as medicine to really help treat and manage a whole range of chronic conditions like cardiovascular disease, metabolic conditions, neurological, cancer, etc. So my clinical and research expertise and interest really lies in fatigue disorders and in cancer populations. So I'll go through some examples and think about and look at a few different conditions, but I might use a couple of examples from those two chronic diseases. So I've got 4 questions here that will just help guide the discussion a little bit. So the first one is about what patient care coordination means from the perspective of an exercise physiologist, who would be involved and what level would this work best at. So I think the first thing that depends for us is really about what context we're seeing a patient in. So exercise physiologists do work in hospitals, but they're not well established like, for example, physiotherapists are or dietitians. So a lot of exercise physiologists work in community or in private practice. There are quite a few exercise physiologists in hospital settings, particularly in cardiac and in cancer in some states in Australia. So if we talk about, for example, a cancer patient in a hospital setting, really that's a multidisciplinary program or interprofessional collaboration working together is really crucial, particularly working with the other professionals seeing the patient, including the oncologist, of course, if the surgeon's involved, a dietitian, physiotherapist. And the idea of this is that, you know, we as exercise physiologists might have our goal, and our goal might be about maintaining patients' functions or actually improving patients' function after going or during chemotherapy, as an example. But we also need to keep in mind, if you have, for example, a head and neck cancer patient, what's the dietitian's role in here? Or if someone's had breast cancer surgery and they're going through a recovery for range of motion with their shoulder, physiotherapists might be involved. So we need to work together to make sure that our management program and our goals are going to work synergistically with the rest of the team as well. From a community perspective, we would work sometimes closely with dietitians. If you have someone who has diabetes, for example, we might want to communicate with their podiatrist or their diabetes educator. A big link, if I go back to the hospital, a big link for us is also the nurses, because often the nurses seeing the patients in the oncology day centre are the ones who see them quite regularly, every week or every fortnight, for example. And so we might want to communicate with them to ensure that, to track how patients are going on their treatment, to see if they're experiencing any side effects, for example. And of course, we'd always ask the patient to see how they're going and how they're travelling. But we would sometimes need to refer back to the other allied health professionals just to be reassured of our understanding or the status of patients' treatment. The other patient population we see sometimes is people with mental illness. And that's really important that we communicate with psychiatrists or psychologists who the patient might also be seeing. And it might be just to understand from their perspective what the management plan is, and then ensuring that we can fit in with that management plan, and vice versa if we're trying to start, for example, a new group program or expose them to a new form of treatment. In the end, the patient really is at the centre of all of this, and that it has to be in the best interest of the patient. So we can suggest and educate on what we think goals might be, but it has to be patient-centred.